First off, the first one that we're going to talk about is what I'm going to call physiologic. This one is related to potential blood flow impairment or potential dysfunction in the autonomic nervous system. And the reason why I'm lumping this in here, I'm not sure if this is an actual cause of headache, but I do know that the treatment helps relieve headache symptoms. Okay, now whether or not that's a secondary thing or whether or not it's actually due to the improvement in the physiologic systems or the autonomic systems or the blood flow systems, or whether or not it's due to kind of a secondary effect. But nonetheless, there's been a lot of research that's looked at exercise as a form of treatment for concussion and persistent concussion symptoms. And generally the way this is done is you go to a clinician who has training in concussion that could administer what's called the Buffalo Concussion Treadmill Test. With this test, we gradually increase your rate of exertion to try and find out what your kind of breaking point is. And what we're looking for during that test is to try and find out not if you get symptoms, because generally people doing this test have symptoms. We're looking to find out what point the symptoms get worse, because the treatment for these types of dysfunctions is exercise. But if you're going to get symptomatic at, let's say, a heart rate of 150 beats per minute, well, I don't want you exercising at 150 beats per minute every day, because you're just going to be flaring yourself up and making yourself worse. So I want to find out what your breaking point is, and I want to lower your heart rate threshold down so that you're actually working out at a rate that's safe, that's not going to exacerbate things and make things worse. And what you do is you do this exercise every single day, this what's called subsymptom threshold exercise, lower than your threshold, and you do this every day for a week or two, and you come back in and we retest you. After we retest you, we can hopefully establish a higher threshold. Once we establish a higher threshold, well, now you're working out at a higher heart rate. And again, it's safe because we've established what the threshold is and we're staying below that threshold. The goal, however, is to gradually work you up to a point where you can have full physical exertion with no increase in any of your symptoms, at which point we can let you go and do whatever type of exercise activity you want to. At the same time this is going on, what you notice is that people's symptoms are rapidly decreasing. Once they get better blood flow, more activity, more, exercise is good for all sorts of things like endorphins and sleep and inflammation and all these other things. The symptoms of concussion, including headache, start to drop. So I'm not necessarily sure that when I call this physiologic headache, that the headache itself is due to the blood flow abnormality that you have or the autonomic nervous system regulation issues. But what I do know is that the treatment of subsymptom threshold exercise helps a lot of people with post-concussion headaches. Now, that could be due to the other things, the inflammation reduction, the better sleep, the endorphin release, etc. Right? So we don't know if that is a cause-effect relationship, but we do know that the treatment is helpful.